Welcome. I think we're all sat down, and again, thank you to Leeds and the team for their support with that video. This conference and our other conferences couldn't happen without the support of our sponsors and our exhibitors, and particularly I wish to recognise now Scandit, our platinum sponsor for the 2019 conference. Please do take time in the breaks and lunchtime to visit the exhibitors as well in the 2 floors upstairs, or in the 2 rooms upstairs. 18 months. Going to talk a little bit about what that's meant, my take on what that means for the NHS in the last 18 months. Very, very broad brush, and I'm not the expert in a room of experts, so it will be broad brush. And then a little bit about GS1 before we move on to the first start of the proceedings this morning. And in the last 18 months, we've had the conclusion of the demonstrator site program for Scan for Safety. Scan for Safety was a terminology. Steve Graham came up with a great idea. It was called the e-procurement strategy. He then had another great idea and called it GS1 and PEPL Standards in Healthcare, which I thought was a brilliant term. And then the trust got together and said, no, that's complete rubbish. Let's come up with something a little bit more snazzy, a little bit more sexy, and they came up with Scan for Safety. And it's great to see and hear the brand and the name resonating today. Recently, also, the Secretary of State talking about it. There's Steve and the team will be talking about Scan for Safety and some results of that shortly over the next 2 days. 18 months in the NHS has been a long time. We said goodbye to this guy, Jeremy Hunt, who's now become our Foreign Secretary and has a career path. And we welcomed this chap. And Matt Hancock comes in with a strong technology agenda. He's clearly a man in a hurry. This is a true picture of him, by the way. I think he was running either to or from Downing Street at the time. Not Andrew Neil, apparently, I'm led to believe. And Matt Hancock has been very clear about technology, and he again has supported Scan for Safety and GS1 Standards. He's also helped with the NHS long-term plan. The long-term plan, which we'll hear from Matthew later this morning about, and David Pryor tomorrow morning as well. We'll talk a little bit about the long-term plan, which helps set forward many of the important things that are going on, including global digital exemplars and workforce and all those things that takes us from the 5-year forward view. Another big thing is the launch of NHS X, which came into shadow being yesterday, I think, and comes into full legal force on the 1st of July. Last week, the Secretary of State announced the new chief exec, or the first chief exec, a chap called Matthew Gould, and there's some lofty ambitions for NHS X. And basically, Matthew said a couple of days ago, our single goal will be to improve the care that everyone in the country gets by making sure that both staff and patients have the technology they need. I will know I have succeeded if in 2 years we've reduced the crazy amount of times that clinicians spend inputting and accessing patient information. I'm not going to read the rest of it. Big, lofty goal, lots of political power behind this, and we'll see how it goes. And I'm looking forward to hearing more about that between now and July, and based on open standards is very, very key behind it. So now I'd like to talk for just a couple more minutes about GS1. And you've heard me say before around GS1 standards is that we help the NHS save thousands of lives and millions of pounds. And we do that through the unique identification of every person, every product, and every place. And that enables improved patient safety, reduced unwarranted clinical variation, and brings along operation efficiencies too. But where's the evidence? Can you prove it? This is a challenge set out actually by Terence Stevenson a couple of years ago, and we will hear more of that over the next couple of days. But I'm going to just give you 3 very, very quick points on this. Improving patient safety. Ian Davidson, chief pharmacist at Cornwall, carried out a study. He's going to tell more about that today. And Ian Davidson found that using GS1 barcodes in the dispensing of his inpatient medicines reduced the prevented error rate by 76%. He eliminated, using GS1 standards, eliminated every error to do with wrong patient, wrong drug, wrong dose, wrong form. Evidence, proof that GS1 standards can help improve patient safety. Reducing unwarranted clinical variation. That's a toughie to prove, because it's very, very hard to prove. And I remember being about a year ago in a meeting again with Terence. We went to see Ted Baker, who's Chief Inspector of Hospitals, who's speaking here tomorrow. And he said, I understand what you do, but how can you help? The one problem we've had perpetually in the NHS, is the wrong insertion of nasogastric tubes. How can you help that? Well, I didn't know. But happily, there's some smart people up in North Tees who do know. And you can't actually prevent a never event. But what you can do is help a doctor to stop making bad decisions. And what happens in North Tees is that if you scan the GS1 barcode on a nasogastric tube, it takes you to the 2010 patient safety alert. It then says, have you carried out a pH test? Because it's pretty obvious, because if it's in the right place, it's going to come up with an acid reading. That doesn't stop a never event from happening. But what it does do is it helps clinician colleagues to have to think 3 or 4 times to keep pressing that button to say they've definitely done it. And it holds them accountable. And that, I mean, we are still having never events today on nasogastric tubes, reducing unwanted clinical variation. And the third thing is operational efficiencies. Here's a story. I was sitting in Derby with our new chairman, Chris Tyus. I was listening to James Main talk about some of the stuff that's happening. Derby have been dealing with GS1 for probably 6 or 7 years, and scanning things there, and now through every single operating theatre. And he said that they've now used GS1 standards and helped join the dots around e-observations. And e-observations has reduced the time it takes to carry out those observations from 5 minutes, 11 seconds, to 3 minutes, 22. That is the equivalent of 30 nurses a day. Extrapolate that to the NHS, and we all know the biggest problem in the NHS is the workforce issue. That is the equivalent of nearly 6,000 nurses. GS1 standards helping improve operational efficiency. So, briefly, 2 announcements. We've got that evidence, we're building more. We are creating and launching today a new website. It's healthcare.gs1uk.org. It's a portal, you'll see more around it, you see the new branding. It's about the evidence and the stories from provider implementations. Please look forward to that, and you'll see some more stories about that as we go through the 2 days. Finally, some breaking news, and this gives me absolute great pleasure. 2 weeks ago, we were able to sign a brand new contract with NHS Digital for the provision of GS1 services for the next 5 years through to the 31st of March 2024. 5 whole years. And this is from a release that's going to go out to the CIOs next week of the whole trust. This is the NHS Digital words, not mine. It enables NHS organisations to continue to use GS1 barcodes for patient wristbands. National Patient Identifier, the wristband. Let's use it, please. Provides greater clarity for GS1 Standards for new applications, and they're across the NHS. And for the first time, highlights CIOs as the accountable people to manage GS1 Standards in their organization. People identification, also place management, place identification. This whole thing about people, product, place. 1 on its own is good, 3 together is critical. Now has, for the next 5 years, has signed up for the subscription of Location Manager, which is the location registry that's global. No excuse not to use it, supported by the centre, and also allows the contract to be used for additional consultancy services if appropriate and when needed by individual organisations. So really great news, and we'll hear probably a little bit more from that when Tom Denwood from NHS Digital is with us later today. So, although I'm banned from telling duck jokes, we will still be raising money for our wonderful friends at the Silver Line who look after old people in need and provide much needed support for lonely aged people through telephone and letters. We have 2 new ducks for you to purchase. We have the mad pharmacist duck. I know how to play to my audience, yes, exactly. And we have the consultant duck. You can tell he's a consultant because of the glasses. So these are brand new ducks available, so please go and support that wonderful cause. Lauren will be looking to help you out later. So wanted to say that, and now we just move on to the final thing that I'm going to talk about, which is the agenda. So this session this morning, we are going to work through to a break. We're going to start off with hearing that from Ant Bennett. We then have Matthew Swindles here to talk to us, and then we'll have a Chief Executives panel, and then we'll go into a break and come back. So, without further ado, I will move on and invite Ant Bennett to join us to the stage. Ant, I think you may remember, was about, I think it was 2006, wasn't it? You were coming back from Disney, school trip at Disneyland Paris, Greenford High School or somewhere, I think, yeah, Greenford High School, coming back. Started to feel ill, went into school the very next day. There was only about 3 of his classmates there. And the next thing he remembered, he was in Great Ormond Street. He was resuscitated 10 times. There, look, you take half an hour to tell that story, and off you go. And it's not coming to tell that story. He's going to come and talk a little bit more about some other things, and it reminds us, in fact, why we all get up in the morning. It's to help provide better patient care for the likes of Anthony Bennett, ladies and gentlemen.